good morning. I am Mr. Javerick B. Amis. I am from Iligan Medical Center College. Now, after preparing the oral medication and the parenteral medication, I'll be performing the administering injections. So first is to do the hand hygiene. So I have here the alcohol. To ensure that medication is sterile. And then to avoid the transmission of microorganisms. Before going to patient's room, compare patient's name and name of medication on label of prepared drugs with the medicine ticket. So you need to check. So what's your name, sir?
Mateo.
Okay. And then double checking the label of medication with transcribe order, reduce, or error. So next is take medications to patient at correct time. So you always remember that the time that given from the medicine ticket, you need to follow that one. So to ensure the intended therapeutic effect and complies with professional standards, so hospitals need to adopt a medication administration policy and procedure for the timing of medication administration that considers patient needs, prescribed medication, and specific clinical instruction. So next is ask the patient his or her name, identify patient using a name tag, compare with information on patient's medicine ticket. So the name tag is commonly here in the hands, in the palm. Okay. To ensure that to have a correct patient. Next is explain purpose of each medication, its action, and possible adverse effects to patient. So sir, I'm going to give you an sterile water for injection, sir. And also your methadone Roxide for your daily. Okay, sir? And then allows patient to express concerns regarding possible non-adherence to therapy and possibly identifies potential errors in medication orders. So perform necessary pre-administration assessments. So to determine whether specific administration should be withheld at the time. So keep sheet of gown or gown draped over body parts not requiring exposure. So to respect dignity of patient while area to be injected is exposed. So you need to provide still the privacy for your patient. So next is select appropriate injection site. Inspect surface skin over sites here for bruises, inflammation, or edema. So the reason is to injection sites need to be free of abnormalities that interfere with medication absorption. So sites used repeatedly hardened from lipohypertrophy. So do not use an area that is bruised or has signs associated with infection. So help your patient to comfortable positions. Is that your comfortable position, sir?
Yes.
Okay. So to reduce strain on muscle and minimize discomfort of injections. So for that is for the intramuscular. So in the intradermal is stabilizes injection site for easiest accessibility. So next is to relocate site using anatomical landmarks. So injection into correct anatomical site prevents injury to nerves, bones, and blood vessels. So to clean site with an antiseptic swab, apply swab at center of site and rotate outward in circular direction for approximately 5 inches. So 5 meters or 2 inches. So far, okay. The mechanical action of swab removes secretions containing microorganisms. But I have here the soaked alcohol cotton balls instead of alcohol swabs. So hold the swabs or goes between third and fourth fingers of the non-dominant hand. So, intradermal. So this one. So the intradermal with non-dominant hand stretch. So skin over site with forefinger or thumb. So needles presses tight, skin more easily. So with needle almost against patient's knee, skin, insert it slowly with bevel up to 5 to 15 degree angle, which is slant. So doing just like this one. So maybe you can put slant, doing just like this. 5 to 15 degrees angle. So you need to get some alcohol swabs or soap alcohol, and then put it in here or clean the site or the area that are going to put in the circular motion. So now remove the cap. Okay. So advance it through epidermis to approximately 1/8 inch below skin surface. So you will see needle tip through skin. So to ensure that needle tip is in dermis, you obtain inaccurate results if you do not inject needle at correct angle and depth. So you just need to make sure that the hands that you're going to be injected is correct. Okay, so 45 degrees, just like this. Next is to inject medication slowly. So normally, so you need to inject the medication to your patient just slowly. Okay, so normally you feel resistance if not. So the needle is too deep. So remove and begin again. But for now, it's okay. So you need to prepare the dry cotton balls. And the non-dominant hand can stabilize needle during the injection. So slowly injection minimize discomfort at site. So dermal layer is tight and does not expand easily when solutions is injected. And stabilizing needle prevents unnecessary movement and decreases patient discomfort. So so while injecting the medication, so notice that small bleb or the 1/4 inch in diameter appears on surface of skin. So slowly inject. And instruct patient that this is normal findings. So bleb indicates medication is deposited in dermis. So okay. And just hold it, sir. Okay. And then withdraw needle while applying alcohol swab or alcohol gauge gently over site. So I'm already done putting. So support or tissue around injection site minimizes discomfort during needle withdrawal. So dry gauze minimizes patient discomfort associated with alcohol on a non-intact skin. So next is do not massage site. So you're not going to massage the site that you're going to be injected. So massage causes underlying tissue damage. So massaging intradermal site disperses medication into underlying tissue layers and alters the test results. So avoid doing massage the site that you're going to be injected. So draw a circle around perimeter of injection site. So to easily identify the injection site. So next is discard needle enclosed in safety shield. So if you're ready. And attach syringe into puncture-proof, leak-proof receptacle. So you have here. So prevents injury to patient and health care personnel. Recapping needles increases risk of needle stick injury. So after doing the procedure or the injecting the intradermal of your patient is you need to perform hand hygiene to reduce transmission of microorganisms. So next is have the site read by the physician within appropriate amount of time to identify any complications associated with injection. So that's all for the administering the intradermal injection. So for the intradermal, the sterile water is you're going to have a 9 ml for the intradermal. So 9 ml. So don't forget to change the needle. Don't forget to change the needle of the tuberculin syringe into gauge 23. Okay, do not forget to change. So, remove the cap and then okay, just like that. And then eye level. So just only 9 ml, okay? Just slowly. Avoid touching. Okay. And the next is the skin testing. So you just need to get away from the bubbles. Okay. Okay. So you have here the 10 ml for the intradermal. So don't forget to change the needle. Change the needle. And then after changing, put the gauge 23 needle to waste receptacles and then turn it back. The normal needle that I'm going to be used for the injection. Okay. So you need to wipe using by the alcohol soak cotton balls. Just like that. Okay, put it in the waste receptacles. And then after cleaning the site, so get some dry cotton after injecting. So remove the cap slowly and then do the 90 degrees for the injection. So gently, slowly release the syringe or the plunger. Push the plunger slowly. I always remember that in doing the intradermal injection is 5 to 10 degrees angle. So just gently, slowly in releasing. Okay, done. So after, so do not massage, just gently push out or remove the needle into the arm of your patient, and then gently, okay. Then after using, return the cup into the needle and then put it in the waste receptacles. So that's it for now for doing the preparing for oral and the parenteral medications, and also for the administering the intradermal and intramuscular injections. So thank you and God bless. So next, I'm going to proceed administering intramuscular injection. So position ulnar aspect of your non-dominant hand just below site and pull skin approximately 1 to 1.5 inches down or laterally to administer in a Z track. So just like this. And hold position until medication is injected. So with dominant hand, inject needle quickly at 90-degree angle into muscle. So the reason of this is to Z-track creates zigzag path through tissues that seals needle track to avoid tracking of medication, to avoid the discomfort of your patient in doing the medication or injection. So the option of for your patient, if patient's muscle mass is small, so grasp body of muscle between thumb and your fingers. So thumb and your fingers. So to ensure that the medication reaches the muscle. So next is to insert needle into muscle with smooth, steady motion after needle presses skin. Grasp. I have here ready. So grasp the grasp lower end of syringe barrel with non-dominant hand to stabilize the syringe. So continue to hold skin tightly with non-dominant hand. So move dominant hand to end of plunger, do not move syringe. So in injecting, so you need to clean first. So you need to clean first the site that you are going to be injected for your patient. Okay. And to reduce pain and at moment of injection and reduces discomfort from needle movement. So next is pull back the plunger if no blood appears. Inject medicine slowly. So to reduce pain, tissue trauma, and chance of leakage of medication back through needle track. So then smoothly and steadily withdraw needle and release skin after injecting. So remove the cap first. And then by injecting by 90 degrees, you need to do the dart position, just like this one, dart position. Okay, so 90 degrees. And inject it slowly. Okay, so you need to get a alcohol soak for after removing. Next is to after releasing, so allows for medication to absorb into muscle. So withdraw needle while applying alcohol swab or gauze gently over site to minimize discomfort. So gently remove the needle from your patient. Okay. So do not massage. So apply gentle pressure, do not massage. So just be gentle. So to prevent underlying tissue damage and also to help patient to a comfortable position to give patient a sense of well-being. So hold it, sir. Okay. So discard needle and syringe into puncture-proof, leak-proof, or the waste receptacle, and to prevent injury to patient and healthcare personnel. So put it in the waste receptacle, and then perform hand hygiene to prevent contamination. And observe patient for any allergic reactions after injecting or after giving the administering intramuscular injection. So to give quick response to any life-threatening reactions. So after doing the procedure of administering intramuscular injection, you need to chart medication, the dose, the route, the site, and the time, and they given immediately after giving medication to ensure the accurate data, and then report any undesirable effects from medication to physician to prevent any life-threatening emergencies.